a very warm welcome on behalf of Nutan College of Nursing, a constituent of the Sankalchand Patel University. Take immense glances to welcome all the distinguished guests and invite at this workshop on pressure injury prevention organized by the Nutan College of Nursing. Prayer should be the occasion for the positive reinforcement of what is right and why, and remember to give credit those who have made it possible. May I request to Miss Krena and Rushika come here and sing the prayer. Thank you, girls. I request Dr. Mahalakshmi, Professor, Nutan College of Nursing, to kind extend welcome and introduce the piece. Thank you, ma'am. So, pressure injury are defined as the localized damage of the skin as well as the underlying soft tissue, usually occurring over a body prominence or related to a medical device. Each year, more than 2.5 million people in the United States develop the pressure ulcer. This skin lesion infection and increase the health utilization. Now, I would like to invite Dr. Mahalakshmi ma'am to introduce the ma'am.
Very good morning, one and all. This is extremely honored to have a chance to deliver my welcome speech on these occasions. First of all, it's of course a great welcome to the dynamic leader, Sri Pragasbhai Patel, the President of SBU, as well as the Provost, Dr. P.J. Vidanisas, and as well as the Registrar of the SBU, Dr. Parimal Trivedi. And I am very delightful to offer a happy welcome to our guest speaker, Ms. Aditi Patel, the most welcome madam on these occasions. And I offer a pleasant welcome to Dr. Sivasubramanian, the principal of the SBU. And next to that, I extend my hearty welcome the coordinator of this program, and as well as have a nice day, and please utilize the session for your future life. Thank you so much.
To add a glory in this atmosphere and to present the current topic on pressure injury prevention.
Good morning to everyone. My name is Aditi Patel, and I am currently a registered nurse in Perth, Australia. I specialize in anesthetics and recovery. I have finished my nursing degree. I went actually after 12th from here. I did my high schools, and then I went to Perth and did a 4-year, 3.5-year course in nursing. I graduated in 2021, just during the COVID peak timings, and then I decided to go for theaters, so I specialize in anesthetics recovery scrub scout. Absolutely love my job, and I'm currently working there. I very much enjoy it, and it is a great pleasure to share my passion with you guys and share this knowledge. So please make the most out of it. I will be taking questions at the end, so feel free to ask any questions related to topic, or if it's outside the topic, please don't hesitate to contact me anytime. And I will be starting my presentation now. So today, as the definition was suggested this morning, it was very well explained. So basically, pressure injury is a localized damage to a skin or an underlying tissue, which comes from a result of a pressure combination with shear, friction, or can be moisture as well. So pressure injury is widely seen in our patients who are mostly bedridden or have some mobilizing difficulties. Today we will be explaining more about pressure injuries, what are the risks associated with it, and what is our job as nurses to prevent our patients from having pressure injuries in future. Pressure injury usually occurs over ruminant bony prominence, but may also be related to a medical device or other objects. So pressure injury is not only caused by lying flat over a surface or only if you're bedridden. If the patient's intubated in ICUs and stuff like that, if you look at the situations, the devices that you use can also cause pressure pressure injuries. So you can think sometimes outside the box, and end of this conversation, we will be able to identify and minimize the risk of our future patients. So just going back to the basics, some pathophysiology of our skins and tissues. I'm pretty sure you must have gotten to the basics. But as I've explained earlier, it is caused by pressure in combination with friction, shear forces, and moistures. Your skin and tissues normally are developed to take certain types of pressure. So it can fight against certain types of pressure. Not all the pressure can cause pressure injuries. So there is this fine line between pressure injuries and risks that we have to understand. So if the pressure exceeds then normally capillary pressure, which our body can handle, which is mostly 12 to 35 mmHg, that increase in capillary pressure can then compromise the tissue circulation and thus restrict the blood flow by causing pressure injuries. And here in the graphics you can see there is the man lying, and if you consider that black brown board as a bed, you can see the head, back, hips, and heels would be the highly dominant prominences, and then those will be the first risk areas that you would see pressure injuries developing. And I've also got a graph of a normal and healthy skin. At the top you can see the tissues are nice and healthy on the first picture where it says normal. I'm not too sure if the girls can back see everything from that distance. But the normal thing, you can see the skin is nice and healthy, the tissues are there, the veins and capillaries are flowing beautifully. If you imagine the surface creating certain type of pressure on your skin, that's going to compress the tissues, and what's underneath the tissue is your nerves and your capillaries. So it's going to compromise capillaries, which is going to restrict the blood flow flowing to that tissue. So what does the blood flow mean? Blood flow is sending oxygen to your tissue, so it's keeping it alive. By restricting the blood flow, you're restricting the oxygen, you're restricting the nutrients that's passing through your skin. So it's basically you're damaging the skin internally. By doing that, it's going to create necrosis, which is a cell death due to deprivation of oxygen. So by compromising that nerves and capillaries, you're damaging the tissues. Over the time, if the pressure is not elevated, it can cause tissue damage, irreversible damage, and you will be facing with wound ulcers, or commonly known as pressure injuries. Pressure injuries can develop as little as 2 hours and can become deep and infected. So all these things can affect your patient's stay. It can also affect our local budgeting levels. So patient has to stay in hospital for longer term, and they have to be treated with pressure injuries because you won't be able to discharge. So it's going to prolongate the period patients are staying in a hospital, increasing the healthcare associated infections, and many more. It's going to add to the effect of budgets as well. And prolonged period of time, just to encapsulate everything at the end, prolonged period of time at any lying surfaces or sitting up, it's going to stop capillary blood flow to the tissue, thus depriving the tissue oxygen levels and nutrients and causing a cell death, also known as necrosis. And in this graph, you would be able to see some different positioning and where you would be able to see pressure injuries commonly. So if the patient's supine facing upright, so normally lying flat on the bed, the back of the head, elbows, sacrum, and heels would be some of the common prominence that you should look out for. So every day when you're doing your nursing scare, this would be the points where you would see to make sure that your patients are not acquiring any pressure injuries. Same goes for if your patient's lying flat for any medical reason or any reasons, those would be the points that you would be able to look out for. And if the patient's prone, so I particularly work in theatre and we do a lot of neurological cases where patient has to be prone, so facing down, and we do long neuro cases such as spine operations and stuff like that. So those would be the points that are outlined there. So cheek and ear, we get to see a lot of patient acquiring redness, rashes when the patient's lying for 12 hours. So it can be prevented. We try our best to create those measures. We use lots of stuff to prevent it, but it's not always possible because you are going to be doing surgeries and you cannot avoid relieving pressures meanwhile. So those would be the prominence that you look out for. And It can occur everywhere, but as I said earlier in first few slides, it's mainly on the bony prominence of the body. Now, some of the risk factors associated with pressure injuries. Does anyone know anything what risk factors we should look out for? What patients are at a higher risk of pressure injuries? Anyone? Yes, pregnant patients. Pregnant patients, because it's going to affect their mobility. So they are carrying a lot of weight. They won't be able to mobilize to their fully capacity. So they will be sitting down, lying flat, or if some patients have some complication, they will be bedridden according to their medical condition. So if the patient's admitted, or if you're doing community nursing, this is the education that you can deliver to your patient. That, okay, you're lying flat. You can also engage into family. Let family know. Improve their healthcare associated knowledge. Educate them and make sure that they are looking out for signs of pressure injuries, because once you acquire pressure injuries, it is going to overcomplicate things that you're already managing. So pregnant lady is such a great example, and if any disease that's going to impair your mobility, so such as paralytic patients who are paralyzed, patients who are intubated in ICUs, patients who are having lung operation, patient having knee or arm amputation. So those patients would be bedridden, and at that time, as a nurse, I think it's our role and responsibility to think a step ahead and saying that, hey, I think the patient's going to lie in bed for certain days or certain weeks. I think we should put some measures in to prevent pressure injuries. So that's one of the risk factors. Second is nutrition state. So any patient, if the patient's BMI is not such great, if patient's having malnutrition, so it's going to take longer for patient to heal, and it's going to take longer for patient's body to deliver nutrients to all part of the bodies. So you have to look out for those signs. If the patient's fasting, so fasting for a longer period of time, patient has some gut problems, so patient might be fasting for a few days. So at that point you have to look out for signs and symptoms of pressure injuries, and we should have some interventions in place to avoid it. Everything comes with an older age, and pressure injury is no different. So you know our older population is very, very frail, can have lots of skin issues, can have lots of medical issues. That's going to add towards the risk of pressure injuries. So all the elderly patients we should take extra care of and prevent them from acquiring pressure injuries. And moisture adds a lot to it as well. Does anyone know why moisture is going to create a risk factor for pressure injuries? Anyone? There is no right or wrong answer. Just feel free to communicate. This is a two-way discussion. I want to make the most out of it. So does anyone know how moisture can affect pressure injuries? Anyone? Don't be afraid. I'm not that scary.
Just to discuss, understand the topic. Understanding or not? You can interact.
If I'm going way too fast, let me know. I can slow it down a little bit as well. I want you guys to make the most out of it and just get whatever knowledge you want. Sure.
That will be more better because they are first years.
Okay, sure. So, किसी को everyone understands Gujarati?
Yes.
Yes. Okay. So, આપણે કોઈને ખબર છે કે moisture એ pressure injuries માં કેવી રીતે add કરશે? I can't hear you, you're too loud.
But speak, no issue.
That's fine, it's no right or wrong
English
options.
नाम में नहीं आता.
गुजराती में बोलो, हिंदी में बोलो, English में बोलो, anyone?
बोलना बेटा.
That's good. That's a very good answer. So if you take an example of if you have a bread at home, think your body as a bread. I know it sounds very bad. So તમે imagine કરો એક bread લીધી છે, બરોબર છે? There is a dry bread in a bag and there is a bread, એક બીજી bread છે જેમાં થોડું પાણી ગયું છે. So બે bread છે, બેમાંથી કઈ bread વધારે બગડશે? પાણીવાળી. Because moisture છે જે it's going to create એવું habitat બનાવશે કે જેમાં bacterial growth easily થશે. બેક્ટેરિયાને moist environment ગમે. So bacteria multiply જલ્દી થશે. અને basically moisture એ તમારી skin integrity ને જેવું કીધું one of the students કે એને breach કરશે. So moisture is going to create best environment for bacterial growth, infection, એ જે પ્રેશર ઇન્જરીઝને વધારે પ્રમોટ કરશે. સો વન ઓફ ધ રીઝન્સ યુ શુડ લુક આઉટ ફોર મોઇશ્ચર્સ. આ મોઇશ્ચર તમે કયા પેશન્ટમાં સૌથી વધારે જોશો? સો મોસ્ટલી bariatric patients, so patient who weigh more than 100 kilos. If your patient is admitting for 120 kilo patient has lots of body folds naturally due to weight. Patient એ પોતાના જાતને ADLs જાતે નથી કરી શકે, so they will have difficulty shower, they are not going to have proper hygiene because you have to make sure your skin is nice and dry. But અગર એ body fold માં કંઈક moisture રહી ગયું છે, if patient cannot completely dry themselves for any reasons, medical condition, whatever condition છે patient, તો અગર પેશન્ટ એની જાતને ડ્રાય નથી કરી શકતું, સો મોઇશ્ચર એના સ્કિન ફોલ્ડ્સમાં રહેશે, બરાબર. સ્કિન એના ઉપર દબાવ આપે છે, ઓલરેડી એની સ્કિન પ્રેશર આપે છે, એન્ડ દેર ઇઝ મોઇશ્ચર. સો મોઇશ્ચરથી એની સ્કિન પહેલાં બેક્ટેરિયલ ઇન્ફેક્શન થશે. ઓન ટોપ ઓફ દેટ યુ હેવ પ્રેશર, સો એને પ્રેશર ઇન્જરીઝ બી થશે. આઈ વિલ શો યુ ધ સ્ટેજીસ ઓફ પ્રેશર ઇન્જરીઝ અત્યારે, તેમાં તમને વી વિલ બી એબલ ટુ અન્ડરસ્ટેન્ડ મચ મોર. સો પ્રેશર એન્ડ બેક્ટેરિયલ ગ્રોથ એ બેઉ થઈને ઇટ્સ ગોના give a good, very well infected wound, which is going to be very hard to treat. And agar a patient ne neuropathic disease hai, the patient would not identify ke ene kai wound thayu cha unless there are nurses who know ke pressure injury a high risk patient hai, they keep on checking to prevent that from happening. So agar a pressure injury is na identified thi, na diagnosed, later it can cause lot more problem, can cause systemic infections, is going to take longer to heal, and a patient no health જે હોસ્પિટલમાં સ્ટે છે વધારશે, બજેટ ઇશ્યુઝ થશે and whatsoever. So moisture is one of the main things that you should look out for. Other disease such as perfusion, chest circulation and oxygenation factors. So there are lots of disease that comes under it, which I'll come back to it in a second. And incontinence भी है, अगर patient बरोबर है, अगर a patient ने urine or feces में incontinence है, कि patient cannot manage it by themselves, mostly seen for elderly patients or bedridden patients है, तो again it's gonna એ લોકો incontinence થશે, એ લોકોને ખબર નથી, it's gonna create moisture because it's wet, create moisture. Secondary जो मैं આગળ કીધું, it's gonna create lots of bacterial infection, pressure injuries and complications વધારશે. So it's very important to keep our patients dry. अगर તમે એવા patients થી deal કરો છો that doesn't have family or is in ICU, so it's our responsibility as nurses to make sure કે આપણે બધા risk eliminate કરી શકીએ છીએ. Second is mental health status. So not all patients, so patient જે medically બીમાર છે એને તો છે જ, but અગર તમે if you're working in psychiatric or something like that, so psychiatry માં તમે જોશો કે patient comes with lots and lots of different diseases or you would say medical conditions જે psychiatry માં થતી હોય છે. Patient, they are seeing things that are not there, patient are scared, patient are in pain, so એ લોકો maybe એ લોકોના behavior પ્રમાણે patient might be lying on bed for hours and hours and hours. We think cognitively ત્યાં છે, patient is communicating, but patient's not moving. So again, patient move નથી કરતો, patient bed માં છે, so it's going to create pressure, restrict blood flow, necrosis થશે, and again they will be developing pressure injuries. And especially for our diabetic patients, so diabetic patient, agar we try our best to promote healthy blood sugar levels, but for some reason જે remote communities માં થતું હશે કે patient are not managing their blood sugars quite well. So agar patient ની irregular blood sugars છે for long period of time, especially if patient's blood sugar is higher at all the times, and a patient manage જાતે નથી કરી શકતો, so over the time એ જે high blood sugars છે, it's going to affect their nerves, neuropathic damage થશે, એ લોકોના vessels બી damage થશે because high blood sugar, there is lots of physiological factors behind it. I know you must have studied it. And એ જે nerve damage ને vessel damage થશે over the time, neuropathic pain બી થશે, and as you must know, neuropathic pain patient ને desensitized થઈ જાય sometimes because any nerves damage થઈ જાય છે, especially for distal proximities like hands and feet. Patient ને nerve damage છે, patient cannot feel કે એ લોકોને pain થઈ રહ્યો છે. So if there is a pressure ulcer there, patient ને feel નથી થવાનો કે મને pressure ulcer થયો છે. So it's our job as to look out for and educate those diabetic patients ke make sure you're checking your skins every now and then. So vessel damage, neuropathic commonly on distal areas, and peripheral vascular disease affecting circulation. અને જે એને diabetic patient એનું vascular system બી બહુ strong નથી હોવાની if the blood sugars are not managed very well. So any wound healing process really ઓછી થશે because as you know, wound healing માટે proper nutrients and circulation જોઈએ. Diabetic patient with neuropathic pain and vascular disease એ બધું સ્લો ડાઉન થશે. સો ઇવન ઇફ દેર ઇઝ અ પ્રેશર ઇન્જરીઝ તમે લોકો એને wound care કરી રહ્યા છો but it's gonna take lot more longer to heal than a normal adult. અગર નોર્મલ માણસને નોર્મલ હેલ્ધી એડલ્ટને પ્રેશર ઇન્જરીઝ થઈ છે it's gonna heal at appropriate time જે આપણે 3-4 weeks જતા હોય એને. અને but if it's a diabetic patient again complications વધશે એનો healing time વધશે અને બીજા બધા બી complications થઈ શકે છે. So especially diabetic patients very very high risk. So again તમે educate કરશો diabetic patient ને એની ફેમિલીઝને એજ્યુકેટ કરશો કે ઓકે તમને અગર આવા સિમ્ટમ્સ છે ન્યુરોપેથિક પેઇન છે સેન્સેશન ડલ છે સો જસ્ટ પ્લીઝ લુક આઉટ ફોર પ્રેશર ઇન્જરીઝ મેક શ્યોર કે તમે ઊભા થઈને ચાલો છો ઇવન ધો યુ ડોન્ટ નીડ ઇટ ટુ અવોઇડ એની પ્રેશર ઇન્જરીઝ ફોર હેપનિંગ. અને this is one of the screening assessment tools જે અમે પર્થમાં અમારી હોસ્પિટલમાં વાપરીએ છીએ. ઇટ્સ કોલ્ડ બ્રેડન સ્કેલ. તમે લોકો આ વાપરો છો? આવો કોઈ સ્કેલ છે અહીંયા કે જે તમે વાપરો છો for pressure injuries? No. So it looks very busy, it looks very complicated, but અત્યારે મેં જે સમજાયા risk છે, પેશન્ટના ડેમોગ્રાફિક્સ છે, it basically constitutes everything. પેશન્ટની મોબિલિટી છે, સેન્સરી રિસેપ્શન છે, એક્ટિવિટી છે, ન્યુટ્રિયન્ટ્સ છે અને ફ્રિક્શન. સો આ બધાને પેશન્ટને ગ્રેડ કરશે કે ઓકે પેશન્ટ કેટલા રિસ્ક પર છે. સો ધીસ ઇઝ વન ઓફ ધ થિંગ કે અગર તમને લાગે છે કે પેશન્ટને જે આ રિસ્ક ફેક્ટર છે ઇફ યોર પેશન્ટ્સ મીટિંગ એની ઓફ ધ રિસ્ક ફેક્ટર્સ સો યુ વુડ થિંક critical thinking again comes into play. I think my patient high risk pressure injuries, I think we should assess a risk. It's not doctor oriented, it is a nursing task કે તમે initiate કરી રહ્યા છો as a patient advocates that you are કે I think my patient વધારે high risk પર છે, let's do a risk assessment. કોઈ medical ની જરૂર નથી એમાં diagnosis ની, you're not diagnosing anyone, you're just assessing the risk and you're communicating it with the team. So you just get this chart અને આમાં મેં જે સમજાવ્યું છે એ છે. So the lower the number, the higher the risk. So જેટલો ઓછો નંબર હશે ચાર્ટ પર એટલો રિસ્ક હાયર હશે. And on basis of that number, you get to decide કે તમારે કેવા interventions મૂકવા છે to prevent any pressure injuries from happening. So I'm not too sure. Can everyone see and read it from this far? So what I can get you to do, take a picture because I have a small activity happening. So take a picture of this and put it in your phone. I'll give you a case study and on top of that case study, we will decide कि a patient pressure injury ना risk पर है के नहीं. Okay? Pretty much self-explanatory है, but I will go through it with all of you. So if everyone wants to take a picture, feel free. So no phones. Oh, no phones available. Okay, that's fine. So જે લોકો તમે લોકો વાંચી શકો છો front row? Anyone? Can you read it? So I think I have got 1 or 2 pages. So આ તમે પાસ કરી શકો. Front row I think can see it, but if you want to pass this somewhere around, I'll take 2 pages. But feel free to come at the front and you can have a read. So once I think if everyone's got the paper, you can make a group out of it and work in a group. So તમે ગ્રુપમાં બી એક્ટિવિટી કરી શકો છો. So basically if I go through this chart, first બોક્સમાં તમને દેખાશે કે it's a sensory perception. So patientની તમે sensory perception assess કરી રહ્યા છો. એમાં તમે જોશો કે patient responsive છે કે નહીં to pain stimulus, or if patient's unconscious, પેશન્ટને કોઈ બીજી વેરી લિમિટેડ સેન્સરી perception છે કે પેશન્ટને થોડીક ડિફિકલ્ટી છે કે પેશન્ટ કમ્પ્લીટલી પેઇન ફ્રી છે, પેશન્ટને સમજણ પડે છે નથી પડતી, ઓછી સમજણ પડે છે, એ તમે ફર્સ્ટમાં રિસ્કમાં અસેસ કરશો. બિકોઝ ઇફ દેર ઇઝ અ પેશન્ટ કે જે તમને સમજી શકે છે તો તમે એને કહેશો કે ઓકે ભાઈ જો કે તને વધારે ડિફિકલ્ટીઝ છે, તું હાઈ રિસ્ક પેશન્ટ છે, ગો એન્ડ વોક, તો પેશન્ટ જાતે ચાલશે. બટ દેન દેર વુડ બી ધ પેશન્ટ કે જેનું નથી કામ કરતું, કોમામાં છે, then its patient is completely limited. So they rely completely on nursing staff to do those cares for them. So patient, that would be a high risk patient. So આ sensory perception માં ઉપર 1, 2, 3, 4 લખેલા છે કે completely limited, very limited, slightly limited and no impact. So આપણે બધા as a healthy living beings we would score 4 કે આપણે કોઈ limitations નથી અને we respond to verbal commands and has no sensory defects કે એ આપણી એબિલિટી છે અને લિમિટ કરશે ટુ ફીલ પેશન્ટને ઇનકોન્ટિનન્સ છે કે નહીં. તો દેટ્સ ગોના ઓલ એડ ટુ મોઇસ્ચર બીકોઝ પેશન્ટને અમુક વૂન્ડ થયેલા હોય છે. અગર પેશન્ટને વૂન્ડ છે તો પેશન્ટની સ્કિન એ મોઇસ્ટ રહેતી હશે. Some patient have very moist skin, some patient has very dry skin. So again તમે સ્કિન સ્ટેટસ એનો કરો છો કે અગર આ બહારથી એને કશું પ્રેશર આવશે કે બહારથી એને એન્વાયરમેન્ટલ ઇફેક્ટ્સ આવશે દેટ્સ ગોના એડ ટુ ધ પ્રેશર ઇન્જરીઝ. સો અગેન તમે મોઇસ્ચર અને પ્રેશર ઇન્જરીઝને લિંક કરી રહ્યા છો. થર્ડ ઇઝ એક્ટિવિટી કે પેશન્ટ કમ્પ્લીટલી બેડ ફાસ્ટ પર છે કે નહીં, કે પેશન્ટ બેડ રિડન છે કે જાતે ચાલી શકે છે. ઇફ બેડ રિડન અગેન ઇટ્સ અ હાઈ રિસ્ક. અને પછી એઝ યુ મૂવ અક્રોસ ધ ચાર્ટ દેર ઇઝ ચેર ફાસ્ટ કે પેશન્ટ ચેરમાં બેસે છે લાઈક સચ એઝ વ્હીલચેર પેશન્ટ્સ કે ઊભા બેસી શકે છે પણ મોસ્ટલી દે સ્પેન્ડ ટાઈમ ઇન ધ ચેર. થર્ડ ઇઝ ઓકેશનલી કે વોક્સ ઓકેશનલી કે એવરી નાઉ એન્ડ ધેન કે જેમ કે ઘૂંટણનો પ્રોબ્લેમ હોય છે કે ઓપરેશન્સ કરાવે છે તો દે કેન વોક ટુ સર્ટેન ડિસ્ટન્સ. એન્ડ ધેન ધ ફોર્થ ઇઝ જે આપણે બધા છે કે વી વોક ફ્રીક્વન્ટલી સો વી ડુ નોટ એક્વાયર ધોઝ પ્રેશર ઇન્જરીઝ ફ્રોમ હેપનિંગ. સો એ એક્ટિવિટીમાં આવી ગયું છે. ફોર્થ ઇઝ મોબિલિટી. સો કમ્પ્લીટલી મોબાઈલ છે કે નહીં, લિમિટેડ મોબાઈલ છે કે નહીં, સ્લાઇટલી લિમિટેડ છે કે નો લિમિટેશન્સ છે. તો અગેન એ મોબિલિટી મેઝર્સ યોર એબિલિટી ટુ ચેન્જ પોઝિશન કે તમે ચાલી તો શકો છો પણ તમે બીજા પોઝિશન્સમાં બેસી શકો છો બીકોઝ ઇવન વન મૂવમેન્ટ કે તમે ઊભા છો બેસો છો ઊભા છો બેસો છો સો ઇટ્સ ગોના અગેન affect those pressure in the same area કે તમારે બેક પર પ્રેશર આવશે. But if you go on the side, સુવા માટે પેશન્ટને સાઈડમાં લાવશો so it's going to relieve the pressure from the back. So we have to also see કે પેશન્ટ ઊભો બેસે તો સહી થઈ શકે છે but અગર પેશન્ટ એની પોઝિશનિંગ ચેન્જ કરી શકશે કે નહીં. So those are two different things. Fourth is patient's nutrition status કે પેશન્ટ ખાય છે કે નથી ખાતો. There are some mental health patient કે જેની ડાયટ બહુ પુઅર હશે. They're going to be reluctant towards eating. So again તમારે જોવાનું કે પેશન્ટની ઇન્ટેક બરોબર નથી. So you measure the intake and see okay that can potentially add towards the risk and healing factors and pressure injuries. So again the nutrition status also we would score 4 on the nutrition because આપણે adequate ખાઈએ છે, we have a healthy eating lifestyle. અને fourth છે friction and shear. તો અગર પેશન્ટ અમુક if you see mental health patient or patient જેમને memory loss કે dementia હોય છે તો if you see that કે પેશન્ટ અમુક વાર છે ને પોતાના હાથ ઘસશે દીવાલ પર કે અમુક લોકો માથા પછાડતા હોય છે મસ્ટ ઇટ્સ વેરી કોમનલી સીન ઇન સાયકેટ્રી. સો ઇફ તમે જોશો કે ઓકે પેશન્ટ પોતાની જાતને હાર્મ કરે છે so it's going to again damage the surface of skin, certainly can cause a pressure injury. So on basis of this આપણે અત્યારે એક કેસ સ્ટડી કરીશું. It is there is a patient Doris is a 77-year-old lady following a recent stroke and is now admitting to the ward. So Doris 77-year-old એક lady છે જેને recent stroke થયો છે અને you are the nurses on the ward અને એ admit થાય છે. ડોરિસને રાઇટ સાઇડેડ વીકનેસ થઈ છે અને ડોરિસ મોબિલાઇઝ નથી થઈ શકતી. She needs assistance to mobilize. ડોરિસને ફૂલી હેલ્પ જોઈએ છે એના એક્ટિવિટી ઓફ ડેલી લિવિંગ્સ માટે such as showering, toileting, feeding, hygiene, everything such as that. And એને સ્પીચ ડિફિકલ્ટીઝ બી છે ફોલોઈંગ અ સ્ટ્રોક કે ડોરિસ સમજી શકે છે બધું બટ એની ફિલિંગ્સ કમ્યુનિકેટ નથી કરી શકતી. ડોરિસ has been living a reasonably healthy lifestyle with adequate diet nil per oral. So Doris generally સારી healthy lifestyle લેતી હતી, સારું ખાતી હતી but currently અત્યારે એ ફાસ્ટ કરે છે because એને સ્ટ્રોક આવ્યો તો and she is awaiting speech and physio review કે એની swallowing capacity એ લોકો ચેક કરશે અને પછી એને ખાવા આપશે because as you know કે after a stroke patient is swallowing difficulties ને બધું affect થઈ શકે છે. You don't want patient to aspirate and end up in ICU. So એ બધું assess થવાનું છે. Doris can easily understand when chatting to her but have troubles communicating herself. So Doris સમજી બધું જાય છે but એ પોતાના જાતને એક્સપ્રેસ નથી કરી શકતી because એને સ્ટ્રોક આવ્યો છે. She got some facial paralysis. So એ કમ્યુનિકેટ નથી કરી શકતી સારી રીતે. તમે લોકો એડમિટિંગ નર્સ છો that thinks કે okay Doris by sound of it she looks like a high risk patient. So તમને લાગે છે કે okay she needs an pressure injury risk assessment to ensure that any કોઈ બી pressure injuries ના risk eliminate કરી છે અને તમે એની holistic care કરો છો outside the medical treatments. So on basis of this I want us to get a number. So Dorisની જે આપણે સિચ્યુએશન લીધી છે જે કેસ સિનારિયો છે એના પ્રમાણે તમને શું લાગે છે કે ડોરિસ ક્યાં ફિટ થશે? સો બધાને આ વાંચવા માટે 2-3 મિનિટ જોવો છો? If anyone can તમે આપણે risk assessment એનું કરીશું. We will do it together. So I'll give you a few minutes to have a read. Old following a stroke, ADLs એ નથી કરી શકતી, currently fast કરે છે અને bedridden છે. Okay, these are the key points. So if you go through the charts, તમને શું લાગે છે કે sensory perception માં Doris ક્યાં fit થશે? So sensory perception, again હું remind કરું છું, it's ability to respond meaningfully to pressure related discomfort. So patient સમજી શકે છે કે નહીં કે ઓકે આપણે આડા પડ્યા છે 12 કલાક માટે તો આપણને થાય કે ઓકે આપણી બેક થાકી ગઈ છે તો આપણે ટર્ન થઈએ તો ડોરિસે સમજી શકશે કે નહીં. Anything, there is no right or wrong answers for this. અગર તમને unsure છો કે patient, there would be cases કે તમને sure નથી લાગતું કે patient કયા બોક્સમાં ફિટ થાય છે because every patient is different. So it's better to mark them harshly કે એને high risk mark કરવો better રહેશે કે rather than એને low risk આપીને આપણે કશું નથી કર્યું. It's better to have interventions in place than not. So if તમને લાગે છે કે Doris is high risk, we can play.
limited sensory perception.
Yes. Anyone else? Are we all happy with slightly limited? Because if we look at it, she has right-sided weakness. So and a right-sided effect છે but her left side is still okay. So left side માં બધું normally કરી શકે છે. So I think it's a great answer. So third, she is slightly limited, so we will score. So એના બાજુમાં box છે, we will score her 3 at this stage of sensory perception. Second is box. Now, she's recently admitted. તમને નથી ખબર એની skin condition કેવી છે. Unless you do a skin assessment, કે તમે visually એનું skin assessment કરો છો, જો છે એની dry skin છે કે નહીં. Or you look at if there are any wound present, કે કોઈ preconceived wounds છે કે નથી અને maybe past operation કરાયો હોય heal down, we don't know. But currently એને કશું નથી, her skin is normal and integrated. So what would you score her as?
Right? That's how she admitted.
Hmm.
That's it. That to remove from 1 or 2.
Yeah. So when in doubt, we always go for a higher number.
Then actually bigger than we can find easy.
Yes, exactly.
Imagination space.
Exactly. So for risk, this scale is done every day. It is a part of our standards. So all the patient admitted to our hospital gets this done in first 8 hours of admission. And patient ne koi bhi medical change tha, medical change, skin integrity change, we have to redo this risk assessment. So it's not just like one time admission ma kari દીધું પછી we are following the same interventions. No, we keep doing it according to patient needs, condition change થાય છે. We keep doing the risk and we keep redoing it. So numbers, if it's a high risk patient, you could see the numbers moving up, or if it's patient getting better, you can see the numbers moving down. So I think we would go for 2. She's off, skin is often but not always moist. Linen must be changed at least once a shift. So ये तमने interventions भी कहे છે. Agar skin is very moist, I think you should change the linen because again કરચોલી વાળો ભાગ છે linen નો. That's why I think nursing માં I'm not too sure અહીંયા થાય છે કે નહીં, but we are trained to have a very tight fitted sheets because अगर wrinkle હશે, patient એના પર lie કરે છે for 24 hours, that wrinkle is gonna cause pressure injury. It's small things as that. Okay, anything small is gonna cause pressure injuries. અહીંયા into only high risk patient. Normal આપણા જેવા માણસો નહીં થાય. But if the patient has mobility issues and whatsoever, it is gonna cause a lot of pressure. So first we have done 3, and for moisture we will score her 2. For activity, what do you think she scores as activity? First, everyone's happy with first because she got stroke. She cannot move. She needs help with her ADLs. So totally nursing but related chat. So we will score her but first. So she's bed fast, confined to bed. So she cannot move unless we help her to move. So if anyone wants to do a math, so 3, 2, 1, so 6. We're scoring at 6. And what about mobility? What do you think Doris nutrition part. Yeah. Yeah, she's good on that. She's just waiting for speech to review her, which is going to be less than 24 hours. You're not going to be keeping patient fasting for more than 24 hours. So she did have generally healthy eating lifestyle. We are just waiting for speech review. So it currently fast karasha, but it's not going to be more than 24 hours. So we can keep her adequate at number of 3. So we are at the total of 3, 4, 5, 6, 7, 8, 9, 10, 11 tasha, and the last is friction and shear. So she could have potential problems, so we will give her 2. So anyone knows what the score of Doris is at the moment? 30. Very good. So Braden scale, a chart named Braden scale kehવાય છે, and this is how it's categorized. So if it's 13, she is at a medium risk, which is 13 to 14 is considered medium risk. Very high risk is considered anything under 10. So any patient falling under 10 is a very, very high risk patient. So we have a specific band. So agar patient a pressure injury band, we give them green bands. So a green band patient a parasha, so it's visual for everyone, all the staff, physio, nursing, dietitians, speech, doctors. Badaને ખબર છે this is a high risk patient for pressure injuries. એ લોકોને it's a multitasking. So બધા એમના બાજુથી બધા effort નાખશે કે nursing make sure કે લોકોનો pressure positioning થાય છે, dietitian make sure કરશે એનું diet બરાબર છે, physio make sure they're able to mobilize, doctor will make sure she is on an adequate plan. So it's like a team work. બધા એક ટીમમાં વર્ક કરીને પેશન્ટનો Braden score manage કરશે. So this is how this scoring looks like. And prevention, which is one of the key factors. તમે લોકો અહીંયા do you do anything for preventing pressure injuries here? What's the shift or every time? 2 hours. 2 hours. Yeah, that's good. Anyone else has seen anything else happening? That's good. Anyone else? Yes, that's very good. Yes, that's very good. That's very good. So prevention, some things that we use according to our charts, can be prevented by again performing risk assessments on the patient. So pressure injury prevent thai શકે છે if you do the risk assessment, you find the risk and then you do interventions in place. So again, pressure injury risk assessment થયું, so you're winning 10% of the game already. So by performing a risk, you know you are alert કે કંઈક થશે, so you will keep things in place and તમે interventions કરી શકશો. Again, you can use pressure relief devices such as air mattresses. So agar air mattresses છે, it's going to deliver air in certain way કે patient ને અલગ અલગ જગ્યાએ body part ના pressure આપશે. So air mattresses again a very good conditions. I recently talked to a doctor and I think he said the patient here can purchase air mattresses by themselves if they are a high risk patient. So air mattress is a great option. And then reporting skin conditions per shift and inspecting the risk areas. So તમને લાગે છે if your patient pressure injury ના risk પર છે, so તમે એની skin condition check કરશો. Just do a visual check. Turn, check, make sure everything's okay, and you document again. And inspect the high risk area, just as bony prominent આપણે કીધા છે, head, neck, hips, heels, every bony prominence, you check it. And then we use something called heel protectors. Agar heel per pressure injuries વધારે લાગે છે, it's a very heavy patient, we put a foam. So it's foam no heel protector બનેલું આવે છે. So we put foam there just to avoid any pressure from causing pressure injuries. And then we do 2 hourly turns as our standards and use a repositioning chart. So we document everything. The patient back par હતો, then we put them on the side, and then left માં હતો, then we do right lateral. એવી રીતે patient અલગ-અલગ positioning change કરે છે. Because once you leave your shift, the nurse does not know કે છેલ્લા 2 કલાકમાં patient કઈ side મૂક્યો હતો. So you document this thing કે patient ને મેં back પર રાખ્યો છે અત્યારે, and then the next nurse coming on the shift can make sure the patient's on the right or the left. So patients not staying in one positioning for longer than 2 hours of time. Again, you're eliminating the risk of pressure injuries from developing. You do daily fluid balance count to ensure adequate nutrition and hydration status is maintained. So fluid balance balance chart તમે લોકો અહીંયા વાપરો છો fluid balance chart? Yeah, intake outtake chart. Yeah, that's the thing. So એને જોશો કે patient make sure કે અગર patient ખાય છે કેટલું પાણી પીવે છે, if patient's on the drip, you add all those amounts that's going in patient's body. You make sure you add કે patient ને અગર catheter છે, IDC છે, patient કેટલું urinate કરે છે, કેટલું બહાર જાય છે, just to make sure કે એનું adult healthy nutrition level and hydration status maintain રહે. અને then અગર patient લાગે છે કે it's a high risk thing, patient ની diet બરોબર નથી, if the patient's not eating, કેમ નથી ખાતો, so you can refer to dietitians and a physio. You can also say કે hey, I think your patient high risk છે, can you come and have a look, કે તમે આવીને જોઈ શકો કે what do you think we should do. So it's like a teamwork. If you think you're doing your best but it's still not improving, you can always ask for help. So you can get dietitian or physio in the team as well, and you can get their point of view, because એ લોકો again આ બધી વસ્તુ they learn all these things and they can actually help patient to prevent pressure injuries. And then again તમે continence management કરશો. Okay, if the patient's using any continence aids such as catheters છે, pads છે, કે એવું બધું વાપરતા હોય છે, so again you make sure it's being taken care of. You check it every now and then, make sure patient is not lying in their feces or in a bad condition, because again moisture is going to degrade the cell, your tissues, and the pressure is going to cause pressure injuries. So very infected wounds could happen. And again તમે educate કરશો, because there's no point you knowing everything and patient not knowing everything. Patient કહેશે કે મને કેમ ટર્ન કરી રહ્યા છે વારે વારે, they don't know, because એ લોકોને નથી ખબર, because એ ભણ્યા નથી, નર્સિંગ નથી ભણ્યા. So again when you educate the patient કે તું pressure injury ના risk પર છે, that's why you just need to make sure કે આવું નથી થતું. So we educate the patient, so family can get alert as well કે oh, I think patient ને risk છે, let's help, because every time you're not going to be able to help them. So if family is present there all the time, તમે family ને કહી શકો કે please position the patient if it's medically okay, કે મને બોલાવજો, we'll do it together. So every 2 hours they can call and you can help them position as you like. So again education is a big part of pressure injury prevention. So you educate patients, family, or sometimes doctors are so tunnel focused ke they have a lot going on, they can easily miss out on pressure injuries. So you can also alert them that I think it's a high risk patient, you should do something about it. Simple as that. And we will now see the stages of pressure injuries. કે તમે risk assessment કર્યું and you're doing visual checks on your patient every day. Now you're seeing is a non-blanching erythema on intact skin. It's commonly seen on patient's bottom. Patient are lying on the back for hours and hours. તમે જોયું, you see this white patch. બાજુ બાજુ તો blood flow થાય છે, but you see that white patch. તમે capillary refills any check કરો છો, but it's not blanching. બધાને capillary refills ખબર છે? Everyone knows about it? Yes, no? Or I can go through it. Everyone? Yeah? Still there. Okay, that's good. So non-blanching તમે જોઈ રહ્યા છો, it's a white patch. So that's one of the first stages કે pressure injuries develop કેવી રીતે થાય છે. So if you see that sign, that's one of the first signs to look out for pressure injuries. કે એ તમને alert કરી દેવું જોઈએ કે okay, this is the sign, I think pressure injuries are going to come later if we don't do anything at this stage. Because બધા patient, you don't know what's happening outside. Admit થાય છે, તમને એની કોઈ conditions નથી ખબર. So if you see that, that's one of the risk factors that you should look out for. And ત્યારે તમને લાગવું જોઈએ કે ના, this is the time to put interventions in the place. So એ white patch થાય છે, ત્યાં pressure ના લીધે એનો blood flow restrict થયો છે, એટલે you can see the blood is not moving in that part. So it's gonna cause cell damage થઈ રહી છે, but that's still irreversible. Sorry, it's still reversible છે અગર તમે pressure off કરી દો તો. So the blood flow is going to start flowing back to that tissue, and it's still manageable at this condition. This is a stage 2 pressure injuries, જેમાં partial thickness skin loss થાય છે, કે તમારો top layer of skin loss થાય છે અને તમારી dermis દેખાય છે. So it's a wound, it's an open wound, કે જેમાં તમારી skin loss થાય છે અને અંદરની dermis દેખાઈ રહી છે. So this is one of the second stages of pressure injuries, and you should start treatment straight away. Agar if you're seeing this at one of the bony prominence, you should start categorizing at pressure injuries and a skin assessment કરો and start treating it as a normal wound you would be. અને તમારા જે પ્રોટોકોલ્સથી તમે એની wound dressing કરવાનું ચાલુ કરતા કરો, take the pressure off, relieve the pressure of that area, make sure proper positioning થાય છે, nutrition થાય છે, બરોબર ખાય છે, પીવે છે, if not dilution and refer કરો. So you would put all those interventions in place at this stage as well. This is a stage 3. So if by anything the pressure injuries have missed, કોઈએ ચેક નથી કર્યું, બરાબર? you come across this. So this is a stage 3 full thickness skin loss થઈ ગયો છે and hard to treat, especially for diabetic patients. Very hard to treat. So again, you would do wound dressings and things like that. At this stage, there is nothing much you can do except nutrition, positioning care, and wound care. Because pressure injuries is mainly for prevention. If you can prevent it, great. If you cannot, you deal with the consequences. And again, you treat it as a normal wound. Hopefully, it doesn't get infected, and you go ahead with it. This is a stage 4 pressure injuries, which has a full thickness skin and tissue loss, and sometimes the bones can appear as well. skin would be the first thing that's going to affect it. So that's one of the first signs that pressure injury is happening. So that's skin would be the first thing to get affected. So if the skin is affected, you can think okay, the pressure injury is starting. Let's put interventions in. It should have been on earlier on, but for some reason, if it's not, you can introduce it just to avoid any further complication. So the pressure injury does not move from skin to tissues or to muscle mass. Does that answer your question? Yeah, perfect. Anyone else? Any questions? कोई भी बीजा questions sir? No questions. Education sir? Education sir? Where's your So I will be around for little bit. कोई ना कोई question if you don't feel comfortable कि public में नहीं पूछा, you can come and see me. I'll be around. So you can ask me any questions if you want. Alright, thank you so much for your time. You did very well, waiting patiently and understanding everything. I wish you all the best for your future and take care. You are the future of nursing, so all the best. Thank you so much.
Thank you so much, ma'am, for your great knowledge. Now, I would like to request Dr. Mahalakshmi, ma'am, to give the gift to our guest speaker, Miss Aditi Ashish Patel.